Welcome to the Nouveau-Brunswick Prenatal Breastfeeding class. This class has been designed by the Nouveau-Brunswick Baby Friendly Initiative Steering Committee in 2020. All information is consistent with the Breastfeeding Committee for Canada's adaptation of the World Health Organization Baby Friendly Hospital Initiative and 10 Steps to Successful Breastfeeding. The class is used across the province, which helps ensure that wherever you give birth in New Brunswick, the information is consistent. Throughout the class, the words mother and mothers are used. Breastfeeding has been traditionally understood to involve individuals who identify as women and has been approached with the assumption that those who are breastfeeding are cisgender mothers. We acknowledge individuals who may not identify as female and are in a human milk feeding relationship with their baby or child. Furthermore, we acknowledge the rich spectrum of family relationships that exist, including LGBTQIA2S+ families, blended families, surrogacy, adoption, and more. The breastfeeding experience may be different for these families, and while it is not within the scope of this course to discuss them in detail, we encourage all families who may want to learn more about breastfeeding in their specific situation to contact their primary healthcare provider or local lactation consultant for more information. Our goal is to provide you with evidence-informed information about the importance of breastfeeding to the health of your newborn and child, and for you, your family, and the community. In addition, our goal is to share basic information to help you breastfeed successfully and reduce the chances of problems occurring. To make an informed decision about feeding methods, you should receive research-supported, evidence-informed information and should discuss any questions or concerns with your primary care provider. Once you make your decision, be assured that staff will support and teach you more about feeding your baby. The content of this class is about breastfeeding. For families who have made an informed decision to use formula full-time or who are supplementing breastfeeding for medical or personal reasons, information about formula, including safe preparation, storage, and feeding, will be given one-on-one. In this way, the family can be sure about the steps that are important to know. All families are supported in their decisions about infant feeding. Here are the objectives for the class. We'll discuss the importance of breastfeeding for optimal health, how to get breastfeeding off to a good start, ways to help make breastfeeding easier, and the value of support and where you can find it. This class contains breastfeeding information that will help prepare you in advance of your baby's birth, as the time you're in hospital is typically quite short and busy. Being prepared ahead is a positive first step. Most mothers stay in hospital between 24 and 72 hours. This depends on how you are recovering from birth and how well your baby is learning to feed. Remember that the healthcare team is there to support you as you become comfortable with your new role as a parent. The health professionals working in the maternity department have taken a specialized breastfeeding course. They can guide you during your pregnancy and from the birth of your child onward. Lactation consultants are also available for consultations. They are qualified to address more in-depth problems if they happen and are able to help and guide you through your breastfeeding journey. Remember that your baby will be feeding often during the day and night, so getting rest throughout the day as much as possible is important. If you have concerns or questions before going home, speak up and let your nurse know. The Baby Friendly Hospital Initiative is a World Health Organization and UNICEF best practice initiative that helps to ensure that parents and infants receive the highest quality of person-centered care. In Canada, we use the term Baby Friendly Initiative to recognize that the continuum of care is seamless between hospital and community services. Baby-friendly facilities create an environment where the decisions of women and their families are protected and supported. Over the past decades, evidence confirms that the Baby-Friendly Initiative improves breastfeeding rates, which is why in New Brunswick, all healthcare facilities are working towards achieving Baby-Friendly Initiative designation. This is what it means for parents. You will be taught about breastfeeding basics, safe skin-to-skin care, responsive cue-based feeding, and how to support your newborn when receiving painful procedures. If you'd like to read more about the Baby-Friendly Initiative, click on the link in the slide. Health Canada and many other health authorities, such as the Canadian Pediatric Society and the Society of Obstetricians and Gynecologists of Canada, recommend exclusive breastfeeding for 6 months. Further recommendations include continued breastfeeding for 2 years or longer, along with the introduction of complementary foods at about 6 months of age. They also recommend that all babies receive a vitamin D supplement. Exclusive breastfeeding means that no drinks or foods other than breast milk are given to a baby. Breast milk contains everything your baby needs for the first 6 months of life. Vitamin and mineral supplements or medicines are permitted if necessary. At about 6 months of age, your baby will show signs of readiness to eat, and they should start to receive complementary foods in addition to breast milk. Breast milk is still the main source of nutrition as you gradually introduce your baby to new nutritious foods. At 12 months of age, breastfeeding continues to be important, providing 1/3 to 1/2 of the calories that your child needs. It also continues to be important for protection against disease. In fact, some of the immune factors in breast milk increase in concentration during the 2nd year. So it is important that your child continue breastfeeding to age 2 or for as long as the family wishes. Please set your goals based on what you feel is important for your family, keeping in mind that every day you continue is important to your health and your child's health. Remember, as the baby grows and is eating solid food, they generally breastfeed less often and for shorter periods of time. There's no age at which the milk runs out of vitamins or protein, so continue for as long as you wish. In some cultures, the child breastfeeds for the first few years and weans themselves when they're ready. Health Canada recommends a daily vitamin D supplement for exclusively breastfed infants of 400 international units daily. You can ask your primary care provider or pharmacist about the correct amount for your baby, as this may be different if your baby is born preterm. Humans are mammals and biologically capable of producing breast milk. Breastfeeding is part of the reproductive cycle. It's natural, but it's not always easy. As with many aspects of parenting, breastfeeding is a new skill, and learning a new skill takes time and practice. Our culture has changed over the last few years, and we're seeing more babies breastfeeding in the mall, at the rink, and wherever else they decide they're hungry. In addition, we're seeing more toddlers continue to nurse for longer than in past years, and continuing to nurse when their siblings are born. We will eventually see the positive impact this has on the health of our population and the impact on our environment. This also means we will have more role models and more people who can support breastfeeding. Each item on this page represents how breastfeeding makes a difference to you or your baby. Before reading the list below, look at each item and see what you can think of. The watch. Your milk is ready to go. Nature's fast food. There's nothing to prepare. Just sit, relax, and enjoy this time with your baby. Money. Breastfeeding costs very little. Use your money for other things you need. Stethoscope. Breastfeeding gives some protection against many childhood infections, especially ear infections and diarrhea. For mothers, there is a decreased risk of breast cancer and ovarian cancer. Tissue. Breastfed children have some protection from illness and allergies. IQ. Breastfeeding supports optimal brain growth and development. SIDS. Breastfeeding provides some protection from sudden infant death syndrome, also known as crib death. CAR. It's easy to go out to travel with breastfed babies. No equipment needed. Milk is always ready, safe, and at the right temperature. Donor blood. Breastfeeding helps to control blood loss after birth. Needle. Breastfeeding helps your baby's immune system be the strongest it can be. It also ensures the best response possible after an immunization. Scales. Breastfeeding burns calories and helps you to lose some of the weight that was gained during pregnancy. It also helps decrease childhood obesity. And the earth. Breastfeeding is environmentally friendly. It leaves no carbon footprint, no waste to go to landfills, requires no external source of electricity, and reduces greenhouse gas emissions. The longer a baby breastfeeds, the greater the positive impact will be on the overall health of the family, society, and the environment. Women who breastfeed also have the hormonal influence that decreases anxiety, stress levels, and promotes relaxation. In addition, the family can save approximately $2,000 or more in the first year without the need to purchase formula and feeding supplies. Preparing for breastfeeding starts when menstrual cycles begin. Your body started to develop the structures that make breastfeeding possible. The process of lactation, or milk production, started as soon as you became pregnant. Hormones cause many changes in breasts during pregnancy to prepare for breastfeeding. Inside the breast, milk glands and tubes, also called ducts, increase in number and grow in size. Some women experience breast tenderness and may notice a change in size. Others experience these changes after the baby is born. On the outside, the areola darkens and may increase in size to help baby locate the breast after birth. Montgomery glands are the raised areas that can be seen on the areola. They produce an oily substance that makes the nipple and areola less dry and helps prevent germs from growing on them. It also helps the baby to locate the nipple immediately after birth, as the smell resembles the familiar smell of the amniotic fluid. Since nature is doing this, it means that ointments or creams are not needed. These products may even be a source of infection and could cause nipple dryness. Scented products can also interfere with the baby's ability to locate the nipple. The breast starts producing the first milk, colostrum, around 16 weeks, or the 4th month of pregnancy. Once a baby is born, the placenta detaches and causes a drop in the hormone progesterone. This tells your body to increase milk production more rapidly and triggers the transition from colostrum to mature milk. Another change in the breasts happens around 3 to 5 days after birth. As milk production surges, the breasts will increase in size. This is what is commonly referred to as the milk coming in. During this time, the breasts may feel full, firm, and somewhat uncomfortable. This is temporary and is called engorgement. Frequent feedings will help relieve the fullness and discomfort during this period. Cold compresses can help decrease the swelling that occurs. The first 24 hours after birth is an important time to establish the breastfeeding relationship. Birth can be exhausting for everyone, and there is a brief window of alertness when a newborn will most easily accept the breast and latch well. Immediate and uninterrupted skin-to-skin contact for the first 1 to 2 hours after birth is recommended for all stable babies and will help to establish breastfeeding. Skin-to-skin contact will be explained more fully on an upcoming slide. Milk is made in the alveoli, milk-producing sacs. With stimulation, the milk travels from the alveoli through a network of ducts to the nipple. There can be 15 to 25 ducts inside the breast. Each nipple has 15 to 25 openings to allow milk to flow to the baby. The amount of milk produced depends on how often and how effectively the baby removes milk from the breast. When the baby breastfeeds more frequently, has a good latch and effective suck, more breast milk will be produced. This is called the principle of demand and supply. For the most part, milk production is a use it or lose it process. The more often and effectively the baby nurses, the more milk is made. The quantity of milk produced is not determined by breast size, although breast size can affect the amount of milk that can be stored. Another factor that affects how often the baby will feed is milk storage capacity. Storage capacity is the amount of milk that the breast can store between feedings. This can vary from person to person and also between breasts for the same person. People with a larger milk storage capacity may be able to go longer between feedings without impacting milk supply and baby's growth. However, if the storage capacity is smaller, the baby may need to breastfeed more often to satisfy the appetite and maintain milk supply. Large or small breasts can produce plenty of milk for baby. Consider this. You can easily drink a large amount of water throughout the day using any size cup, small, medium, or large. But if you use a smaller cup, it will be refilled more often. Your breast milk will change during the time that you breastfeed. These changes happen naturally and are controlled by hormones and your baby. There are 3 changes that occur in the first few weeks. The milk changes from colostrum, then into a transitional milk, and finally becomes mature milk. Colostrum is produced from about the 4th month or 16th week of pregnancy. It appears as semi-transparent, thick and sticky, and may range in color from pale yellow to a deep golden shade. It acts as a lubricant and aids in emptying the baby's bowel of thick meconium, which is dark green stool. It is also the baby's first immunization against bacteria and viruses. It is made in small amounts that will fill the baby's stomach. The stomach grows and expands in the first few days after birth, and the supply of colostrum increases during this time as well. Transitional milk is produced in greater volume by the body starting around the 3rd day after birth and continues to change until mature milk is made. The color of the milk can change as well. Transitional milk is a combination of colostrum and mature milk, and it's important to remember that colostrum is part of your milk for approximately 21 days after birth. Mature milk is reached between 2 and 3 weeks after birth. It can resemble 1% milk in color and thickness. Mature milk is made up of both foremilk and hindmilk. Both are nutritious and important for your baby to have. Foremilk is higher in water, which helps to quench your baby's thirst, and also contains water-soluble vitamins. It is high in lactose, the sugar that gives the baby energy to complete the feeding. It's the milk that the baby receives at the beginning of the feeding. Hind milk is higher in fat and other vitamins. The higher fat milk adds the extra calories the baby needs to help feel full and sleepy. The transition from foremilk to hind milk occurs naturally as the baby drains the breast. There is an increased concentration in immune system boosters in the second year, which helps to provide more protection for your growing toddler. Breast milk is never boring. It changes often to keep up with your baby's needs. It can change according to the gestational age of your baby at birth. For instance, the milk of a mother giving birth before 37 weeks gestation has more protein and higher levels of some minerals. It can change with your baby's age, for instance, moving from colostrum to transitional milk and then mature milk. It can change according to the time of day. For instance, milk typically contains more fat at night. During the feeding, foremilk at the beginning of the feeding versus hind milk later in the feeding. According to the seasons, in the summer, the milk contains more water. It can also change with what you eat. The flavor can change, or between breasts, for instance, when someone is tandem nursing. It also changes with exposure to infection, for instance, increasing in white cells for either the baby or the breastfeeding parent. Human milk or breast milk is specially designed for baby. It has many live components and contains all the nutrients to ensure your baby reaches their full growth, development, and immune system potential. It provides immunity for babies as it contains antibodies and other factors to protect the gut, white blood cells to destroy harmful bacteria, components to prevent germs from attaching, beneficial bacteria, and is a natural antibiotic. Breast milk is safe, always at the right temperature, and portable. Positioning can make a difference for both you and your baby during feedings. There are no definite rules, however, there are some checkpoints or tips to help. The goal is that you are comfortable and the baby has easy access to the breasts and achieves a good latch. Try a variety of breastfeeding positions to figure out what works best for you. Please practice with a doll as you view the next few slides. The most common positions are laid back or baby-led latching, cross cradle, football, cradle, lying down, and positioning for tandem feedings. Find a position that is comfortable for you. Remember that while baby is learning to feed efficiently, you may be sitting for a while, so comfort is important. Maintain good posture and body alignment with your knees slightly higher than your hips. You may need to use something under your feet. Sitting in a chair might be easier for positioning. However, if you're uncomfortable while sitting, lying down can also work. Try to avoid leaning forward to breastfeed. Bring the baby to you and not the breast to the baby. Support for your back or arm may help. Pillows can be used for support. However, a special breastfeeding pillow is not required. Here are some tips for your baby's position. The base of the head and the body should be supported. The head should be at the level of the breast or slightly under. The ear, shoulder, and hip are in a straight line, with the head and neck slightly extended in a sniffing position. Their chest should be facing your chest to chest or tummy to tummy. And their nose faces your nipple, with the baby's chin touching your breast. These tips are important for all the breastfeeding positions that you use. Practicing using a doll or a teddy bear until the real baby arrives will help you build your skills and confidence. Laid back or baby-led latching is a natural and simple way for baby to get to the breast. It is helpful for when the baby is learning to breastfeed, not breastfeeding well, or if your nipples are sore. You should be comfortable in a laid-back position with the baby lying skin to skin, tummy down on your chest. In this position, the baby's instincts kick in, They will start to search for the breast and often will latch with a very wide mouth. Practice with a doll or a teddy bear. Click on the link in the slide. Other common breastfeeding positions include football, cross-cradle, and lying down. Click on the link in the slide to learn more about these positions. Click on the link in the slide to learn more about these positions. Many mothers continue to breastfeed their toddler during and after pregnancy for a new baby. This is called tandem nursing. For the majority of healthy people, this is safe. Talk with your primary care provider if you would like to do this. It is possible to nurse twins, and in fact, multiples can be very successful at breastfeeding. If you're expecting multiples, connect with others in your community to see how it worked for them. During the first days in hospital, staff will help you make sure each baby knows how to latch well, and then will help with feeding them together if you wish. The cradle or saddle positions may also be used. Click on the link in the slide to learn more about these positions. Correctly latching the baby to the breast is important for many reasons. It can prevent sore nipples. The initial few seconds of the latch may be slightly uncomfortable. However, there should not be any pain. There will be a tugging or pulling sensation as the baby stretches the nipple back to the soft palate. A good latch also ensures your baby can transfer milk easily. Picture a straw. When the baby has a wide mouth, the straw is round and allows a good flow of milk. If the straw is pinched, it takes more work and takes longer to get the same amount of milk out of the straw. In addition, the nipple may become damaged. Good latching also helps establish an abundant milk supply. The breast is drained more effectively, which tells it to refill abundantly. In order to achieve an effective latch, the baby should be skin to skin and tucked in close. Turn your baby's entire body, not just their head, chest to chest and tummy to tummy. Support your breast with your hand in a C or U hold, depending on what is comfortable for you, keeping your fingers well back from the areola. In the C hold, the fingers are flat against the chest wall below the breast, with the first finger or two supporting the breast. The thumb is on top of the breast, above the areola. With a U hold, the hand is under the breast, against the chest wall, with the web between the thumb and first finger supporting the breast. The thumb will be on one side of the breast, with the rest of the fingers on the opposite side. Baby's nose should be at the same level as the nipple, nose to nipple. Touch the baby's upper lip just under their nose with the nipple to encourage them to open their mouth wide. This will place the lower lip down low enough so that it covers a large portion of the areola. Wait until the baby opens his mouth wide, like a yawn. Bring the baby onto the breast while the mouth is open wide. The baby should be supported at the base of the head and shoulders. If the baby has latched correctly, the nipple should be round at the end of the feeding. It will not be pinched or flattened. When breastfeeding is first being established, supporting the weight of the breast throughout most of the feeding will help to maintain a deep latch, particularly if the breast is heavy. Women who have larger breasts may choose to use a small roll, such as a face cloth or receiving blanket, under the breast for extra support. Once breastfeeding is established and the baby can maintain a deep latch, support during the entire feeding may not be necessary. However, if at any point nipples become sore, encourage a return to supporting the breast. More information about latching your baby can be found in the video Attaching Your Baby to the Breast. Click on the link in the slide. The following slides will discuss the differences you might see between a good latch and a poor latch. In the first picture, a good latch, the chin is touching the breast, the nose is away from the breast, the mouth is wide open with the lips flanged, and the areola is more visible above than below the mouth. This is an asymmetrical latch. In the second picture, a poor latch, the chin is away from the breast, the mouth is not open wide, and the lower lip is pointing forward or turned in. The areola is more visible below than above, or there is an equal amount. If you experience pain when breastfeeding, remove the baby from the breast. To do this, gently insert a finger into the corner of the baby's mouth. Break the suction and take the baby off the breast quickly to prevent ongoing damage. This will also tell the baby that the latch was not correct. These pictures demonstrate the differences between a good latch and a poor latch. In the first picture, the nipple is round when breastfeeding is finished. In the second picture, the nipple is flattened and pinched. A poor latch will cause sore nipples, a hungry baby, and a reduced milk supply. If pain is felt when the baby is on the breast, not simply a passing discomfort, a poor latch may be the problem. Gently remove the baby from the breast and start again. It's important to remember to take the baby off the breast and break the suction gently by inserting a finger into the corner of the baby's mouth. Leave it in the baby's mouth between the gums until the baby is completely off the breast. If you just break the seal, there is a risk of the baby closing their mouth on the nipple as it is being removed, thus damaging the nipple. Picture 1 shows an example of a good latch. The baby's chin is touching the breast. The nose is away from the breast with the mouth wide open. The areola is more visible above than below the mouth, and the cheeks appear to be full and rounded, not dimpling in. Picture 2 is also a good latch. The chin is touching the breast, the mouth is wide open, both lips are flanged or turned outward. The areola is more visible above than below the mouth, and the cheeks appear to be full and rounded, not dimpling in. Picture 1 shows an example of a poor latch. The chin is away from the breast, and the mouth is not wide open. The areola is also more visible below than above. In picture 2, the mouth is not wide open. The upper lip is turned inside, and again the areola is more visible below than above. A poor latch is the major cause of sore nipples. If you have sore nipples, fix the latch. You can also express some colostrum or milk and let it air dry on the nipple. The best treatment for sore nipples is to prevent it from happening in the first place. So remember to be patient and wait for the baby to open the mouth as wide as they can. Watch them when they yawn or when they're showing signs of hunger and rooting. This will tell you how wide they can open. There are some practices that really help get feedings off to a good start, and some other practices that may slow things down. Even if it isn't a perfect start, with a bit of time, patience, and practice, breastfeeding is still worth the effort. Be kind to yourself and give it time. As parents, it's important to be well informed with all things related to labor and birth and the effects on breastfeeding. For example, understanding what types of interventions can be used and why, and also making a birth plan and discussing it with your primary care provider during prenatal visits and at admission is important. However, you also should be aware that sometimes situations can come up, and there are no guarantees that everything will go as planned. Non-pharmacological methods for comfort during labor are a priority. Research demonstrates that some interventions in labor, such as drugs and medical procedures, may affect the baby's alertness and their ability to coordinate the suck, swallow, and breathe pattern that is necessary for effective breastfeeding. Talk with your primary care provider about what options are available for pain relief during labor and birth. Ask questions so that you have the information you need before labor starts and make an informed decision based on what is best for you. If you need interventions that make the baby a bit more sleepy after birth, keep your baby skin to skin with you as much as possible. Start frequent hand expressing to have your colostrum to use during the time the baby is sleepy and may not be latching well. This will help the baby to wake and feed more effectively. It also helps ensure that the baby is getting the food that is needed so that you don't have to worry about using other types of milk. Patience is a great parenting skill to have, and you can practice it during this sleepy time. Skin-to-skin contact begins an amazing process between you and your baby. It helps you bond with the baby, feel more confident caring for your baby, recover from giving birth and regulate hormones, and also to recognize when your baby is hungry. It can also help with breastfeeding and building your milk supply. Skin-to-skin contact helps your baby adjust to life in the outside world, regulate their heart rate, blood pressure, blood sugar, breathing, and body temperature, and develop protections against harmful bacteria. It also helps them feel safe and warm, calm down when they're fussy so they cry less, control pain during blood tests and needles, and get a good start with feeding. Skin-to-skin contact should begin immediately after birth for all stable babies and should not be interrupted, unless for a medical reason, for the first 1 to 2 hours after birth, or until the first feeding is accomplished, or until you wish to stop. All the positive points listed above happen when mother and baby are together. Your partner or support person can also provide skin-to-skin contact if you are unavailable or unable to, and it is mutually agreed upon. Your baby feels secure by recognizing your heartbeat, voice, and smell. It's a special time between you and your baby. It is a good idea to hold off on visitors and phoning, emailing, or texting the news. Weighing, measuring, and bathing the baby can be done after the baby has breastfed the first time or two. Routine hospital procedures, such as vitamin K and any assessments, should be performed with the baby on your chest, skin to skin. Skin-to-skin contact involves placing the baby, tummy down, on your bare chest, wearing only a diaper, immediately after birth and during the early weeks and months of life. The baby should be covered lightly with a blanket. A hat may also be beneficial for the first few hours until the temperature is regulated, but should not be necessary long term. Practice safe positioning of skin-to-skin care with a doll or teddy bear. Every time the baby is skin to skin, it's important to follow these points. Your baby's shoulders, chest, and hips should face you. You should always be able to see your baby's face. The baby's head is tilted up in a sniffing position, not looking down. Their nose and mouth should not be covered. Their head is turned to one side, with their neck straight, not bent. The baby's legs should be in a frog leg position, and the baby's back is covered with a blanket. If you are sleepy, put the baby in the bassinet or skin to skin with someone else who is awake and alert. At the hospital, You will be monitored continuously by staff in the birthing area and regularly on the postpartum unit. Look at these pictures and think about some of the points that make them safe or unsafe. Most babies will show readiness to feed in the first 30 to 60 minutes after birth. Watch for the baby to show signs or cues that they are ready to feed, and take advantage of this time. Ensuring the baby's latch is correct, and feeding the baby until they are content. Generally, the nurse is with you during this time, so ask all the questions that come into your mind. These early feedings will help ensure the baby's blood sugar stabilizes and helps them to pass their first bowel movement, meconium. Once this first period of alertness passes, babies will usually have a longer sleep period for approximately 3 to 5 hours. Make sure you rest during this period, as once the baby wakes again, feedings may be fairly frequent, including during the night. Early and frequent feedings ensure a good milk supply and longer duration of breastfeeding. Rooming in refers to the practice of a baby staying with you in the same room during the hospital stay and room sharing for the first 6 months of life at home. During your time in hospital, we encourage you to rest and nap while your baby is sleeping in their bassinet. In hospital, most medical procedures can be done while you are breastfeeding or doing skin-to-skin, and there is no need for your baby to leave your site at any point. At home, you can bring baby's bed into your bedroom. There are many reasons to keep your baby close. Breastfeeding is made easier. You're more confident about feeding and caring for your baby. You learn your baby's feeding cues and are able to respond more quickly. Responding more quickly means the baby will cry less and use less of their energy stores, and there's also less temptation to give artificial feeds. Keeping your baby close also supports parent-infant attachment, and your baby is colonized with your normal body bacteria, giving them additional immune protection. Don't hesitate to ask to see identification from any person who enters your room and says they are taking the baby for tests or anywhere outside of your vision. You should ask to accompany the baby if they are taken out of the room. The following are some practices that help breastfeeding. Babies need to eat often. They need to eat at least 8 times or more per 24 hours in the first few weeks. They should also feed until they are full, the same as adults do. Sometimes parents expect or have been told that babies should have a routine and eat on a schedule. However, it's important to feed the baby as often as they show signs of being hungry. Some babies will have 3 or 4 feedings close together and then rest for a longer time. This is normal. Frequent feedings help to control physiologic jaundice. They limit weight loss and they encourage early weight gain. Frequent feedings don't mean that there's not enough milk or that the milk is not good enough. The production of breast milk functions on a use it or lose it basis. Frequent and thorough milk removal is the key to maintaining a good milk supply. It is important to pick up on your baby's early hunger cues. These include increased alertness, moving during sleep, or having REM sleep, smacking or licking their lips, opening and closing their mouth, and sucking on their lips, tongue, hands, fingers, toys, toes, or clothing. If the baby has not been fed after showing early hunger cues, they may exhibit mid-hunger cues. This includes rooting around on the chest of whoever is carrying the baby, trying to position for nursing, either by lying back or pulling on clothes, squirming around, hitting on the chest or arm repeatedly, fussing, or breathing fast. If the baby has not been fed when they're exhibiting early or mid-hunger cues, they may show late hunger cues, which include moving their head frantically from side to side and crying. Breastfeeding is much calmer and easier when you respond to the baby's early hunger cues. The following is an exercise to compare your eating patterns with your newborns. Take a minute to think about a day when you had free access to food. Think about how often you had something to eat or drink, and the length of time it took you to finish your snack, drink, or meal. Think about how you feel when you're really hungry or thirsty and have no access to food or drink. Now, answer the following questions. How often did you eat? The average is about every 1 to 3 hours. How many times did you eat in 24 hours? The average is 8 to 12 times. How long did the meals take? The average is 20 to 30 minutes. Are there times when you would take longer for a meal? For instance, in conversation, social time, or relaxing? How do you feel when you're truly hungry or thirsty and can't get food or water? Are you angry and feel like you have no energy? Maybe you have a headache? Does skipping a meal teach you to go longer without food or make you more desperate for it? Are you trying to gain weight? Babies have to double their weight in 4 to 6 months. What would you do differently from what you're doing now if you had to double your weight? Infants need to gain weight and double their birth weight by around 6 months. This means they need to eat often, including at night, and benefit from high-calorie foods, like hind milk. Postponing or delaying feedings, giving empty calories, like water instead of milk, shortening meals, or letting babies cry it out are not activities that promote weight gain. Remember that there are no calories in a pacifier, and there's never an advantage to keeping a baby hungry when they need to eat. Only the baby can determine when they are hungry and when they are full. Babies come in different weights and lengths and have very small stomachs when they're born. Their stomach can't hold very much at a time, especially in the first few days. They need to feed a minimum of 8 times in a period of 24 hours. It's important to follow the baby's hunger cues. Remember to watch for these cues, as sometimes they're very subtle. If your baby has had a long labor or complicated birth, they may need to have a gentle reminder to feed frequently. Every baby is different and has different feeding patterns. Feedings change from day to day, depending on many factors, including stomach capacity, activity, growth spurts, hunger, and the amount of milk that is removed and the amount available. What does this mean in terms of milk the baby needs and how often they'll feed? A newborn baby, for the first 1 to 2 days, has a stomach about the size of a cherry. At 3 to 4 days, it is the size of a walnut. By day 5 and 6, the stomach is now the size of an apricot or ping pong ball, and at 1 to 3 weeks, it's about the size of an egg. As the baby grows, the amount of milk the stomach can hold will change. Trust the baby to tell you when they are full. The use of artificial nipples, such as bottles or soothers, should be avoided until the baby has learned how to breastfeed well. Using artificial nipples or bottles before the latch is well established may interfere with the baby learning to latch properly. This can lead to breast refusal or painful cracked nipples. If you make an informed decision to use artificial nipples, try to wait until breastfeeding is well established, usually at around 6 weeks. Remember that all babies learn at different speeds. Some babies will have latch figured out quickly, while others may take a while. Don't rush them into trying to learn too many things at once. Artificial nipples are rigidly shaped, in contrast to breasts, which are soft and flexible. To nurse effectively, a baby must open his mouth wide and position the nipple at the back of its mouth, away from the movement of the gums and tongue. An artificial nipple is easily inserted into a baby's mouth even when it is almost closed. The mechanics of muscles used for suckling also differ when a baby is drinking from a breast versus a bottle. A baby who satisfies their need to suck using an artificial nipple will also spend less time stimulating the breast and could potentially decrease milk production. It's also easy to give too much food when bottle feeding, since an infant with a full stomach may continue to drink if their need to suck has not been satisfied. If a situation comes up where the baby needs extra fluid or food, hand expressing to get your colostrum or breast milk to use is important. Frequent hand expressing or pumping will help to ensure you continue to build your milk supply and have your own milk to feed the baby. If there's a medical reason for supplementation, staff will discuss this with you so you can make an informed decision about how the baby will be given the milk. If there's no access to your own colostrum or milk or donor breast milk, and formula is to be used for a number of feedings, information regarding the safe preparation, storage, and appropriate volumes will be reviewed with you. You will also receive printed information. Follow-up should be arranged to ensure that you and the baby safely return to exclusive breastfeeding as soon as possible. This slide shows ways to give supplements other than by bottle. These options are by cup, lactation aid, spoon, or by finger feeding with a tube. Frequent hand expressing will help increase milk production and give you the colostrum and breast milk needed for the supplement. If you're worried and are wondering if your baby needs something more, please discuss it with your nurse or primary care provider. If your baby is latching well, feeding vigorously, and you can hear swallowing, your baby may be asking for comfort to be with you. It's not always about more food. The provincial booklet, Breastfeeding Your Baby, has great information for you to read, including information about storing and freezing your milk. Swaddling has previously been used as a method to help calm a baby in hopes that they will go to sleep and sleep for longer periods. In the first few months, babies are not meant to sleep through the night. Babies communicate their needs by moving, sucking on their hands, and then by crying, a late sign. If they're tightly bundled, they can no longer tell their parents when they're starting to get hungry, are upset, or lonely. Research has shown that swaddling at birth and afterwards can be detrimental because the lack of skin-to-skin contact decreases the hormones that are produced during skin-to-skin care. It also can make latching more difficult and interfere with breastfeeding. Tight swaddling over a long period of time has been linked to hip dysplasia and respiratory difficulties. Parents should follow the Health Canada and Public Health Agency of Canada recommendations for safe sleep for their baby. Click on the link in the slide. The first few days of life with a newborn are a learning experience. Every newborn is unique. Your baby is no longer in the warm, comfortable womb and has to adapt to unfamiliar sounds, light, smell, and temperature. It is common that the newborn wakes up and parties on the second night. This can be overwhelming for everyone, especially if there have been visitors during the day and parents haven't had the opportunity to get some sleep. Sleep as often as you can. Some parents start to think that the baby is not getting enough to drink or are using them as a soother. Many newborns just need the reassurance that is provided by breastfeeding and skin-to-skin contact. This will help them feel comforted and more settled. Frequent feedings during this time will really help milk production. Parents also need reassurance that breastfeeding is going well and that it will get better. click on the link in the slide. Every baby is different, and feeding patterns are varied. Babies should be fed every time they show signs of hunger, or at least 8 times or more in a 24-hour period. Many babies feed frequently, both day and night, in the first few weeks. Gradually, they begin to sleep for longer periods and stretch out the time between feedings. Some babies will drink from both breasts at each feeding, while others are content with only one. The length of a feeding varies, with some babies being satisfied very quickly and others lingering over their feeds. It is normal for babies to cluster some feedings together and then have a longer sleep of 3 to 5 hours. As a family, there will eventually be a balance between what the baby needs and introducing new routines like baths and bedtime. The routine will change as the baby grows older. Some days, babies may seem unsettled and want to breastfeed or snack frequently, similar to our days when we snack a lot throughout the day. These are days when the baby needs more calories to support an upcoming growth spurt. Growth spurts are normal, but can be different with every baby. The baby often will feed more frequently during this time, which usually happens around 10 days of age, 3 weeks, 6 weeks, 3 months, and 6 months. For comforting or soothing the baby, you can breastfeed, cuddle skin to skin, or walk, talk, sing, and rock your baby. You'll eventually find what works best for you and your family. Having family, a friend, or a support person can also help you with comforting the baby. The following slides look at some signs of successful breastfeeding. Reliable signs that your baby is getting enough milk include adequate weight gain. Your baby may lose 5 to 7% of their birth weight in the first 3 to 4 days after birth. After this, they should return to their birth weight by 10 to 14 days of age. The baby should also be passing urine in an amount that is appropriate for their age. They also should be passing stools that are appropriate for age. Both of these can be found in your Breastfeeding Your Baby resource. The baby should be alert and growing, and they should look relaxed and sleepy after they've finished feeding. The following are some signs of effective suckling and milk transfer. No pain is felt. Slow, deep sucks and swallowing sounds or visible swallowing is heard. The cheeks are full and not drawn in. The baby feeds calmly. The baby finishes the feed by themselves and seems satisfied. And the breasts feel softer and lighter after feeding. Signs that the baby may not be suckling effectively include continuous, rapid, shallow sucks or smacking or clicking sounds, cheeks that are drawn in, a baby who is fussy at the breast and comes on and off, a baby who feeds very frequently for a long period of time but does not release the breast and seems unsatisfied, or when pain is felt. Many parents worry about not producing enough milk for their baby. This is rarely the case. Situations of actual low milk production are usually related to factors that limit the amount of milk the baby removes from the breast. If the milk is not removed, less milk is made. Some ways to build your milk supply include stimulating the breasts and removing milk frequently, generally at least 8 times in 24 hours, including at night. Following the baby's feeding cues instead of scheduling feedings. Eating and drinking well by following Canada's food guide to achieve balanced nutrition. Getting adequate rest. Room sharing with the baby to help identify and respond to early feeding cues. And delaying the introduction of artificial nipples until the milk supply is well established at about 6 weeks. Hand expression and breast compression are techniques that help with milk production and supply. Using breast compression is an effective way to increase milk flow and breast drainage and improve the baby's suckling pattern. To watch a video on breast compression, click on the link in the slide. The vast majority of people who breastfeed all over the world are able to produce enough milk for their babies. Again, your body is designed to produce the milk to nourish your baby. However, there can be situations which complicate the demand and supply equation, affecting how much milk you produce. Understanding these potential risks and addressing any issues that arise can help ensure your baby gets everything they need. Common causes of low milk transfer include an ineffective attachment to the breast or poor latch, ineffective suckling, short or infrequent feedings, or when the baby is ill or weak. Common causes of low milk production include infrequent feedings, scheduling or shortening feedings, and not draining the breast well, or low milk transfer. The following slides discuss wet diapers and bowel movements. In your baby's first few days, his poop will be dark green to black, like the first photo. This first bowel movement is called meconium. Colostrum, the rich first milk you produce, acts like a laxative and helps your baby pass the meconium. The sooner and more often you breastfeed, the quicker the meconium clears from the baby's system. As your milk supply increases, the baby's poop will change from the meconium to a dark greenish color in the second photo, and after the milk supply takes a large increase, the color changes to a yellow, mustardy, runny, seedy poop. It may be soft like toothpaste or grainy and liquid. The change in the color and frequency of the bowel movements is a fairly good indication that your baby is getting enough calories to grow. A well-fed baby can pass a bowel movement every time they feed. This is not diarrhea. It's normal. Infrequent bowel movements during the first month are usually a sign that the baby is not getting enough breast milk. At all ages, urine should be clear to pale yellow in color and almost odorless. Seeing some brick dust colored crystals in the baby's diaper in the first day or two of life is common. These are called uric acid crystals, and you shouldn't see them after the first few days of life if your baby is drinking well. The following are normal volumes of urine and poop that you can expect from your baby. On day 1, they should have at least 1 wet diaper and 1 or 2 sticky, dark green to black bowel movements. On day 2, they should have at least 2 wet diapers and 1 or 2 sticky, dark green to black bowel movements. On day 3, at least 3 heavy wet diapers and 3 or more brown, green, or yellow stools. On day 4, at least 4 heavy wet diapers and 3 or more brown, green, or yellow bowel movements. By day 5 and older, you should expect your baby to have at least 6 heavy wet diapers and 3 or more large, soft, yellow seedy bowel movements. After their first month, some breastfed babies may have 1 very large bowel movement every 1 to 7 days. It's normal for breastfed babies to have many bowel movements every day. Use the following as a guide for your baby's diapers. A wet diaper equals 2 tablespoons or 30 mils of urine, and a heavy wet diaper is at least 3 tablespoons or 45 mils. You can practice what this feels like at home with water in some of your baby's diapers. Hand expression is an important skill to learn. The primary reasons that someone might want to express breast milk include the baby not latching effectively in the first few days, so it might be necessary to stimulate the breasts and feed the baby some colostrum. The breasts may be too hard for the baby to latch onto, and expressing the milk can make them softer. You may want to provide breast milk for your baby during an absence. You might also need to increase your milk production. You may want to also offer drops of milk to your baby to encourage suckling. And you can also use expressed breast milk to rub on sore nipples. Practice that help the milk flow include sitting comfortably, relaxed, and thinking of the baby, warming the breasts beforehand in a shower or with a warm face cloth, massaging or stroking the breasts, getting a back massage, expressing breast milk in the morning when the breasts are fuller, or after breastfeeding. When expressing milk by hand, the following technique can be used. Wash your hands, gently massage the breast, place the thumb and fingers around the areola in a C shape, press back towards your chest, compressing your fingers together around the areola, then relax the compression. You can collect the drops of milk in a cup to give to the baby or save for later. Go all around the breast, repeating steps 2 to 5 until the milk stops flowing. Change breasts and do the same thing again, starting with the massage. You can return to the first breast afterwards. Prenatal hand expression is becoming more common. For example, if you have diabetes, you can hand express and freeze colostrum at home to have it ready to use in the hospital if your baby has problems with blood sugars after birth. This should be discussed with your primary care provider a few weeks ahead of your expected due date. That way, plans can be made to ensure the milk is kept frozen until it is needed. Talk with the lactation consultant at your facility to make a plan. The following slide contains information on choosing a breast pump. When deciding what kind of pump to buy, or if one is even necessary, consider how often it will be used, how easy it is to use and clean, and of course, how portable it is. Many mothers find that they never need to use a pump after seeing how easy it is to take a breastfed baby along on outings, or how easy hand expressing can be. Others who will be away from the baby for a longer period of time will need some way to express milk. Many women find it easy to hand express milk when needed. Remember, no electricity or battery is needed to hand express. If you do choose to use a breast pump, there are many different kinds of pumps available. Manual pumps are those that you operate by hand. They are easy to carry and usually easy to use and are designed for occasional pumping. Battery-operated pumps are also for occasional use and may be easier to use than a hand pump. Electric pumps are designed for more frequent or regular use. They are generally fast and may be more comfortable than manual pumps. The newer models are very lightweight and very portable. These pumps are meant to be for single-person use only, unless it's specifically stated otherwise in the manufacturer's guidelines. Mothers who have preterm babies often find that electric pumps are the most efficient option. Everyone is different in their response to a breast pump. It's important to remember that a pump never drains the breast as effectively as the baby would. This means that we cannot compare the amount of milk that is pumped to the amount that the baby actually drinks from the breast when latched well and feeding vigorously. If you decide to pump exclusively, frequent pumping, at least 8 times or more in 24 hours, is needed to establish and maintain an adequate milk supply. Whichever pump is chosen, the manufacturer's instructions should always be followed to know how to use it safely and how to clean the pump parts. Wash your hands before pumping and handling any milk that will be stored. A note on milk banks and donor milk. The World Health Organization states that the best food for a baby who cannot be breastfed is milk expressed from the mother's breast or from another healthy mother. In some provinces in Canada and throughout the world, there are human milk banks. These facilities collect and pasteurize milk in a secure way. Donors are screened before the bank accepts the donation. In Canada, Donor milk banks are located in British Columbia, Alberta, Ontario, and Quebec. For now, in New Brunswick, donor milk access is limited to babies with specific needs and in certain NICUs in the province. Obtaining milk from another mother and not from a regulated milk bank is called informal milk sharing. This may be unsafe. Health Canada advises Canadians to be aware of the potential health risks associated with consuming breast milk obtained through the internet or purchased or exchanged directly from someone you know or do not know. There is a potential risk that the milk may be contaminated with bacteria or viruses, such as HIV. In addition, traces of substances such as prescription and non-prescription drugs can be found in breast milk. Improper hygiene when expressing the milk, as well as improper storage and handling, could also cause the milk to spoil or be contaminated with bacteria and/or viruses that may cause illness. It's recommended to consult with your primary health care provider if you have questions about breastfeeding and donor milk. Did you know that if you stop breastfeeding for a length of time, it's possible to restart and build your milk supply again? This is called relactation, and the lactation consultant in your area can give you guidance and support to help you rebuild your milk supply. For information on how to store breast milk, click on the link in the slide for information from the provincial booklet, Breastfeeding Your Baby, with recommended storage guidelines. The following are topics you might want to consider in your day-to-day life with your new baby. Nutrition. There are no food restrictions during breastfeeding. People across the world have different diets, for example, no dairy products, eating spicy foods, or gassy vegetables, and they still produce milk for their babies. There's no need to drink milk to produce milk. Only under extreme cases of deprivation will the quality of breast milk be affected. Breastfeeding mothers who do not feed themselves properly may still have a healthy baby, but it will be to the detriment of their own health. The body will make milk production its first priority. Following Canada's food guide is recommended for a balanced diet. Remember to drink well and stay hydrated. Water should be the priority beverage, and many mothers will have a glass of water each time they sit to feed the baby. Going out. Babies are portable, and breastfeeding makes it easy to take the baby anywhere and everywhere. There's no need to bring any equipment, heat the milk, or wash the bottles. However, if parents want to go out without the baby, they can plan ahead by expressing or pumping milk and leaving it for the caregiver to feed the baby. Contraception. The lactational amenorrhea method, or LAM, is 98% effective when the 4 following conditions are met. Your baby is under 6 months of age. Your monthly periods have not returned. Your baby is breastfed exclusively with no other foods or fluids given. And your baby breastfeeds at least every 4 hours during the day and at least every 6 hours at night. Unless all 4 conditions are met, another family planning method is advised. Many other family planning methods are compatible with breastfeeding. However, contraceptives containing hormones can impact your milk supply. Birth control methods that contain estrogen, including the pill, the patch, or the ring, will decrease your breast milk production. Progestin in contraceptives, such as the mini pill, may decrease breast milk production. During your pregnancy, talk to your primary care provider or a sexual health clinic about contraceptive options to help you make the best decision after the baby arrives. Prescription and non-prescription medications and supplements. Most prescribed medications are compatible with breastfeeding. You should remind your prescribing healthcare professional that you are breastfeeding so that they can prescribe the medication that is safest for you and your baby. Herbal products and over-the-counter medications may not be compatible. You should discuss this with a pharmacist or primary care physician before making any assumptions of safety. Natural is not always safe. Dr. Tom Hale's Medications and Mother's Milk is a great resource. Contact the lactation consultant in your area for more information about any particular medication. Drinking alcohol is not recommended during breastfeeding. Alcohol gets into your breast milk through the bloodstream. It shows up in your breast milk almost right away and is at the highest level at around 30 to 60 minutes after you start to drink. The long-term effects of daily use of alcohol on the infant are unclear. Several proven or potential adverse effects of alcohol on breastfed infants have been reported, even after moderate consumption. These adverse effects can include impaired motor development, changes in sleep patterns, increased risk of low blood sugar, decrease in milk intake, a decreased letdown reflex and milk supply, an impairment of parenting skills, judgment, and alertness. If you're thinking of drinking alcohol, you should follow these rules to reduce the risks to the baby. Pump and store your breast milk before having a drink so that the baby can continue receiving breast milk while you're drinking. Limit the amount to 1 to 2 drinks per occasion. Drink alcohol after breastfeeding, not before. And allow enough time for the alcohol to be eliminated from your body before the next feeding. It takes up to 2 hours, on average, for one drink to be eliminated. Tobacco and vaping. Smoking is harmful for parents and the baby and is not recommended. Chemicals from cigarettes are passed to the baby through breast milk. The concentration of nicotine in breast milk varies depending on how many cigarettes have been smoked and how much time has passed since the last cigarette. E-cigarettes are battery-powered devices that typically deliver nicotine, flavorings, and other toxicants and solvents through an inhaled aerosol. Little is known about the effects of e-cigarette use by the mother on the infant's health. Smoking may also interfere with milk production and can lead to early weaning. Health Canada reports that smoking cigarettes increases a baby's risk of SIDS. Health Canada reports that smoking cigarettes increases a baby's risk of SIDS. For more information, click on the link in the slide. If you smoke and are not able to quit, it does not mean you should not breastfeed. It's better for the baby to receive the immune system boosters that give protection against allergies and illness than to take that benefit away by not breastfeeding. It would be best to quit or cut down on the amount that is smoked for everyone's health. If you smoke, you should delay smoking until right after each session of breastfeeding. Secondhand smoke also affects the baby. It's your job as a parent to protect your baby from secondhand smoke. You should not hesitate to ask people to smoke outside and not let them hold the baby until they change their clothes and wash their hands. Cannabis in all forms. The current recommendation is to stop using cannabis in all forms while pregnant and breastfeeding. There is no known safe amount of cannabis use in pregnancy and when breastfeeding. The THC in cannabis passes through the breast milk and is stored in the fat cells and brain of the baby. It can be stored for weeks. Secondhand cannabis smoke may result in illness in infants and young children. It is not recommended to smoke or vaporize cannabis in your home, around your baby or young children. Consuming cannabis in any form, edible, smoking, or vaping, may impair your parenting skills, judgment, and alertness. If you consume cannabis and are not able or not going to stop using, you need to talk to your primary healthcare provider to ensure that you make the best decision in your situation. For more information on cannabis while pregnant or breastfeeding and long-term effects, you can refer to Risks of Cannabis on Fertility, Breastfeeding, Pregnancy, and Parenting. Click on the link in the slide. The following slides describe some common challenges. Painful nipples. Breastfeeding is not supposed to hurt. A small tug might be felt when the baby latches on and is often described as uncomfortable. This is different from the pain of a poor latch and generally lasts for only a few seconds at the beginning of the feeding. The most common cause for sore nipples is a poor latch. Signs and symptoms of sore nipples may include a nipple that is pinched or misshapen after feedings, or nipples that are damaged or bleeding. Ways to prevent painful nipples include ensuring that the baby latches correctly at every feeding. To help relieve the pain, expressed breast milk can be rubbed on the nipples after feeding and left to air dry. It is important to keep the nipple dry and change your nursing pads if they become damp. Trying different feeding positions might also help relieve the pressure on the area that is sore. Perhaps starting the feedings on the least sore side temporarily will help improve the soreness. It is also important to support the breasts when breastfeeding. If the pain does not resolve quickly, parents should get help as soon as possible to avoid further problems. Engorgement. Breast engorgement refers to a breast that is overly full to the point of hardness. It may occur 3 to 6 days after birth if the baby is unable to drain the breast effectively, or at any time that the breasts are not drained well. Signs and symptoms include breasts that are not compressible, generalized pain and tightness, general redness of the breast, and a low-grade fever may be present, below 38.5 degrees Celsius or 101 degrees Fahrenheit. Ways to prevent engorgement include feeding the baby frequently with no restriction on the length of time, offering both breasts at each feeding, ensuring the baby is latched well and positioned correctly. The baby should also be fed at early feeding cues and before the breasts become uncomfortably full. If the baby is unable to latch effectively, expressing some milk before the feeding can help. Putting a warm compress or cloth on the breast just before the feeding can help the milk flow. An ice pack wrapped in a cloth or a cold washcloth can be put on the breasts between feedings to help decrease swelling. Parents should get help if the baby continues to have problems latching. Plugged ducts. Plugged ducts may occur in any area of the breast from which milk has not drained. The area may be red and tender. There is no specific cause for plugged ducts. However, it may occur more often in women who experience engorgement or an overabundant milk supply. It may also be caused by stress, fatigue, positioning difficulties, an ineffective suck or latch, infrequent, hurried, or shortened feedings, or wearing clothing or bras that are tight and restrict milk flow. Plugged ducts can develop into mastitis if the milk is not drained from the area. It should be noted, a plugged duct may occur in the underarm area, as there is also breast tissue there. Signs and symptoms of a plugged duct include a lump or swelling that can be felt, tenderness, heat, and possible redness in the area, a white dot or blister at the end of the nipple indicating a blocked pore, a slight increase in temperature of less than 38.5 degrees Celsius, or signs of mastitis, which will be reviewed on the next slide. You can help resolve a plugged duct by beginning the feedings on the breast with the plugged duct until the lump and pain are gone. Changing breastfeeding positions may also help to drain all areas of the breast. A gentle massage over the lump towards the nipple before breastfeeding and while breastfeeding can also help. Ensure the baby is correctly latched and positioned. Applying a warm compress before breastfeeding or taking a warm shower can help the flow of milk. Feed the baby frequently, including overnight, and if a feeding is missed, expressing or pumping the area is important to prevent further complications. Plugged ducts usually resolve with continued breastfeeding. Mastitis. Mastitis is an inflammatory condition of the breast. If it is not treated quickly, it can develop into an infection. It starts suddenly and usually occurs in one breast only. Signs and symptoms include redness, heat, and swollen spots on the breast, possible red streaks on the breast, pain, flu-like symptoms including chills, aches, and fatigue, a fever greater than 38.5 degrees Celsius, and nausea. Causes of mastitis include engorgement or inadequate drainage of the breasts and plugged ducts, sore, cracked nipples, stress and fatigue, overabundant milk supply, a previous history of mastitis, missed feeds, and rapid weaning. You can help mastitis resolve by feeding frequently, ensuring the baby is latched well and sucking and swallowing effectively to remove milk from the breast, applying warm compresses to the affected area, or taking a warm shower or bath, gently massaging the affected area while heat is applied to promote milk removal, beginning feedings on the breast with the mastitis if it is not too painful. If it is too painful, the unaffected side should be offered first for a short time. Use a variety of feeding positions to promote drainage from all areas of the breast. Avoid placing prolonged pressure on the breast. Medications might be prescribed or used, for instance, antibiotics or analgesia, which is pain medication. Abrupt discontinuation of breastfeeding for any length of time without regular expression to effectively remove milk from the breasts can lead to complications such as engorgement, plugged ducts, prolonged or recurrent mastitis, or an abscess. The composition of breast milk changes during mastitis. There is an increase in anti-inflammatory components in the milk to protect the baby from the infection in the breast, so it's safe and recommended to continue to breastfeed. The sodium content also increases, and the flavor of the milk may change. During times of flooding, unsafe water, fires, pandemics, or other emergency or stressful situations, breastfeeding is an essential, safe source of food security for babies and young children. Breastfeeding continues to be important, and milk supply will remain as long as the mother is supported to continue to feed the child as often as the child is asking. Ensuring that the mother gets rest, food, and fluids is important for her well-being. If the baby becomes unwell, the mother's body will respond to the bacteria or virus that the baby has and will produce antibodies that pass through the milk to the baby to help boost the baby's immunities. Babies who are unwell may not feed for as long as they typically would, so it's suggested that the mother monitor the milk supply and consider hand expressing or pumping after a few feedings to ensure that the milk supply does not decrease. Breastfeeding during the COVID-19 pandemic. The coronavirus outbreak has been a stressful time for families. Parents of breastfeeding children and those who are considering breastfeeding may be feeling especially concerned about the virus and their baby's health. Breast milk provides immune factors and antibodies that protect them from many infections, including respiratory illnesses. These benefits can last throughout infancy and childhood. Because of the many benefits of breastfeeding, you are encouraged to continue. The Public Health Agency of Canada says even if you have or think you have COVID-19, you can still hold your baby skin to skin and stay in the same room if preferred, especially during the establishment of breastfeeding and bonding. Parents who have or think they have COVID-19 should take all possible precautions to avoid spreading COVID-19 to their baby when feeding. Breastfeeding is the safest way to feed your baby and young child. Breast milk has antibodies and immune factors that protect your baby's health. As with other respiratory illnesses, if you are breastfeeding, you are encouraged to continue. Expressing breast milk, either manually or with an electric breast pump, may be done if you wash your hands before and after touching your breast, the pump, or other bottle parts. If you are a confirmed case or a symptomatic case under investigation, someone who is well could feed the expressed breast milk to your baby if you are unable. Whether breastfeeding or bottle feeding, if you have been diagnosed or are under investigation for COVID-19, you should take precautions to prevent transmission to your baby. You should wear a mask when near your baby, including during feeding. If you are feeding your infant with infant formula, you should keep a 2-week supply on hand. Infant formula should be prepared using strict sterilization techniques, as outlined in How to Feed Your Baby with Infant Formula. Homemade infant formula is not recommended. These recipes may not provide the proper balance of nutrition that infants need. Homemade infant formulas can cause severe malnutrition and potentially fatal illness in infants. The following advice will help reduce you and your baby's risk of infection and help prevent the spread of infections. Wash your hands often with soap and water for at least 20 seconds. Avoid touching your eyes, nose, or mouth with unwashed hands. Avoid close contact with people who are sick. When coughing or sneezing, cover your mouth and nose with your arms or tissue. Wash your hands and dispose of any tissues you have used into the garbage. Avoid contact with people who are sick. Stay home if you're sick to avoid spreading the illness to others. Clean the following high-touch surfaces frequently with regular household cleaners or diluted bleach, 1 part of bleach to 9 parts water, toys, toilets, phones and electronics, door handles, bedside tables, and television remotes. You have the right to breastfeed anywhere, anytime. This right is protected by the Canadian Charter of Rights and Freedoms. Each province and territory in Canada has a human rights code. The code provides protection against discrimination on the basis of sex. Your baby has the right to eat anytime, anywhere hunger happens. In New Brunswick, the Human Rights Act prohibits discrimination in accommodation, like hotels, services, or facilities available to the public, for instance, stores, restaurants, schools, government programs, public spaces, and shopping malls. Providers of these services and facilities cannot prohibit breastfeeding or limit someone's ability to breastfeed. This information can be found in the Guideline on Pregnancy Discrimination by the New Brunswick Human Rights Commission. Breastfeeding continues to be important when you return to school or work outside the home. You are encouraged to approach your employer or educator to inquire about possible accommodation prior to returning to your workplace or school. Employers who support breastfeeding reap many benefits, including less absenteeism among employees as breastfed children are healthier, lower prescription benefit costs for the employee's child, increased retention rates following employee maternity leave, better employee morale and productivity, and enhanced corporate image. If it is not possible to breastfeed the baby during work hours, it is suggested to breastfeed exclusively and frequently during maternity leave, continue to breastfeed whenever you are together, enjoy skin-to-skin time with baby whenever possible, introduce other feeds only a few days before returning to work, express breast milk when possible every 3 hours at work, Provide expressed breast milk to the caregiver for the baby's feeds. Teach the caregiver to give the feeds in a safe and loving way, using a cup rather than by bottle, so that the baby will continue to want to suckle at the breast. And have contact and support from other working parents who are breastfeeding. Anyone in New Brunswick who experiences harassment while breastfeeding may lodge a formal complaint with the New Brunswick Human Rights Commission. Going home with your baby. Infant feeding practices have changed over the years. More and more families in New Brunswick are breastfeeding. Beginning a family is one of the most joyous, yet most overwhelming, life-changing experiences. A new job or skill takes time to learn, and often we need to ask for help from other people. Learning to parent is the same. You may think that if you ask for help, you may be perceived as being bad parents or unable to cope. Support from your partner, grandparents, friends, and communities can have a positive effect on your breastfeeding success. Supportive partners and friends make a difference when facing feeding challenges. They can also be very helpful when dealing with family or friends who are unfamiliar with breastfeeding and question it. You are encouraged to discuss your plan for breastfeeding with your partner, family, or friends, and plan ahead for how they can help. Here are some things family members and friends can do to support you. Show respect for your decision to breastfeed. Offer help with daily chores, such as cooking, cleaning, shopping, and offer encouragement during times that you feel tired or overwhelmed. Be sensitive and listen to you when you talk about your needs and concerns. Ask how they can help. Offer advice only if asked. Family and friends can also help you feel comfortable breastfeeding around them and others. They can support you by sitting and chatting with you while you're feeding. Remember, it's a woman's right to breastfeed anywhere, anytime, and a baby's right to eat anywhere, anytime that they are hungry. Here are some things partners or support people can do. Be supportive. In the beginning, breastfeeding takes time to learn. Every mother and baby needs practice. Learn about breastfeeding together. Go to prenatal classes, read books, or check out breastfeeding websites. Help boost her confidence with breastfeeding. In moments of doubt, encourage her. Listen to her needs and feelings. Be sensitive and ask how you can help. Encourage her to rest. Help out with everyday chores, such as cooking, cleaning, shopping, laundry, and caring for your other children. Keep her company while she is feeding. Bring her food, something to drink, or anything else she may need. If you're away, keep in contact. Call or text with words of encouragement. Speak up to family, friends, and others about breastfeeding. It's a woman's right to breastfeed anywhere, anytime, and a baby's right to eat anywhere, anytime they're hungry. For a list of local breastfeeding support services in each area, click on the link in the slide. What to avoid saying to a breastfeeding parent. Are you sure you have enough milk for your baby? Your milk looks thin. Is it rich enough? Are you feeding the baby again? Give a bottle once in a while. A bottle won't hurt. The baby needs to get used to bottles. Give your baby cereal. It will help them sleep through the night. I think your milk is drying up. Having a baby is an exciting time, but it can also be overwhelming. Many women go through a short period of the baby blues as they adjust to their new parenting role and their body adjusts to the hormonal changes after birth. You may notice some moodiness, tearfulness, irritability, or have trouble sleeping. Talk to family and friends about how you're feeling. This period usually only lasts a few weeks and is normal. At times, well-meaning family may suggest that breastfeeding should be stopped to give you a break. Breastfeeding and skin-to-skin have been shown to contribute positively to a mother's mental health. Breastfeeding and skin-to-skin promote rest and recovery and help regulate hormone levels. Research has also demonstrated that breastfeeding mothers have better quality sleep than those who do not breastfeed. Postpartum depression is different and more serious. It often occurs in the first few weeks or months after birth, but can happen later as well. Symptoms can include feelings of hopelessness, trouble sleeping or eating, extreme sadness and frustration, and feeling disconnected from the baby. Many people also experience anxiety or panic attacks. Having a prior history of depression and/or anxiety can increase the risk for postpartum depression. It is very important that partners, family, and friends take these symptoms seriously. If you are experiencing any of these symptoms and they aren't getting better, contact your primary health care provider or call 811 for help connecting to support services. Many treatment options are available. You can continue to breastfeed during this time if you wish. If medication is offered, ask the primary care provider to ensure it is safe with breastfeeding. Most medications, but not all, are safe to use. Some things you can do to promote positive mental health include sleeping when you can, eating well, taking a walk outside, talking to your partner, friends, or family about your feelings, joining a parenting group or activity, planning something small to look forward to each day, like meeting a friend or taking an exercise class. You should also be aware that social media, for instance Instagram and Facebook, can be a tool to connect with other new parents, but can also become a source of negative feelings of comparison. The following videos showcase New Brunswick parents talking about their breastfeeding experience and what support meant for them. Click on the photos to play the videos. You are also invited to join the New Brunswick Facebook page on breastfeeding. More than 4,220 parents have shared their experience, tips, and more. It is a great online support and also a place to get information about support services, classes, and other topics. Encourage your partner, support person, or family to join the page too. The Facebook page is bilingual, and you're welcome to post in the language of your choice. This concludes the New Brunswick Prenatal Breastfeeding class. Thank you for your participation. Please refer to the following slides for resources and references from the presentation.